and we're going to be reviewing how to use pregnyl with my patient.
Hi, I'm Morgan, and I'm going through fertility treatments.
Okay, Morgan, so we're going to be using pregnyl as your injection, but essentially pregnyl and Navarel, that's all used exactly the same way, it's just a different manufacturer. All right, so upon receiving your medication, you're also going to have a placemat, and the placemat serves as a visual guide, so you're going to see that there's guides on the bottom that say medications, refrigerated, and equipment. So the pregnyl is highlighted in green. That indicates that it's a medication. So when you're ready to use this medication, you're going to open up the box, and you're going to see that you have a powder and a liquid vial inside. Okay, you'll note that the powder vial has a very scant amount of powder inside. Okay, that's not supposed to be. And then you're going to have the liquid vial. Okay, this has no medication at all in it. It's just used to dilute the powder. Okay, so you're going to have leftover liquid in here, and that's fine. Don't be alarmed. It just gets discarded into the schrafts container. All right, after you open up that box, you need to find some additional supplies as well. So you're going to have a 3 ml 22 gauge needle syringe combination, and they're going to be in a bag, and the bag's going to be labeled used to mix and draw up pregnyl. Okay, and then aside from this, you're also going to have a bag of 27 gauge half-inch needles, and that bag's going to be labeled used to inject pregnyl. So it's much smaller, just a needle, no syringe attached. Okay, so you're going to take your liquid vial. You're going to pop the safety cover off of that. You're going to clean the top of it with an alcohol swab. Okay. And from there, you're going to take your 3 ml 22 gauge needle syringe out from the packaging. The first thing you're going to do is pull back on the plunger so you have a milliliter of air inside, or whatever your specified liquid dose is. Yours was 1 ml. Okay. So from there, you're going to uncap the needle. You're going to insert the needle into the liquid vial above the level of the water, and you're going to push on the plunger of the syringe to dispense that milliliter of air into the vial. Okay. From there, you're just going to turn that vial and syringe upside down together, and you're going to pull back until you have a milliliter of the liquid inside of the syringe. Okay. Turn it right side up, remove the needle from the vial. That vial gets discarded into the schrafts container. You can carefully set down this needle and recap it. Then you're going to pick up your powdered vial, pop the safety cover off that one. And once again, we're going to clean the top of it with an alcohol swab. Okay. From there, you're going to take that same needle and syringe, and you're going to go into your powdered vial now. And you're going to push on the plunger to dispense that milliliter of liquid into this vial. Okay? Now, leaving this needle and syringe attached on top, you're just going to pick up the vial straight between your hands and roll it back and forth, kind of like you're warming up your hands. Okay, from there, you're going to take a look at the vial, make sure all that powder has been dissolved into the liquid. You're going to take your 25 gauge out of the package. And this is the one that was labeled for injecting, and you're going to twist that one onto the 3 ml syringe. Okay? From there, you'd be ready to do your injection. So the area that you're going to be doing the injection is your buttocks. Okay, you could use either your right or your left side. It doesn't matter. This is once and done injection. You're only using it for one time. Okay, so to give you an idea of where you're going, you could pretend that there's a circle around one of your entire butt cheeks and then a giant plus sign dividing it into 4 quadrants, and you'll be using the upper outer portion. From there, after you select your site, you're going to clean the skin with an alcohol swab. Okay. Then when you're ready, you're going to uncap the needle, and you're going to spread the skin so the skin's nice and taut between your thumb and your index finger, and you're going to go straight in with the needle all the way in at 90 degrees, but you're not going to inject yet, okay? You're going to have to do something very important called checking for placement. So to do this, you're just going to pull back on the plunger of the syringe, and one of two things can happen. Either you're going to see blood aspirate into the syringe, or nothing's going to come into it. So if you see blood, you're just going to remove the needle from your body. You're going to carefully recap your needle, twist it off from the 3 ml syringe. You would apply pressure to that injection site, okay? And then you would swap it out for a new clean 25 gauge needle. And you might see a little bit of your own blood mixed in there. That's fine. So you're just going to try to inject again, going 1 to 2 inches away from where you tried last, okay? So you would once again clean the skin, spread the skin, you're going to uncap your needle. And you're going to go straight in again, all the way in at 90 degrees, pull back on the plunger of that syringe. At this point, nothing should come into the body of the syringe, so you're safe to inject. Go ahead and push your full dose. Then you're going to hold it there just an extra 5 seconds to make sure you got everything. Okay. Then you're going to remove it from your body, and the whole thing goes into the sharps container.